Okay, picture this. You're in the hospital, or maybe you're visiting a loved one, and you realize something's different. The family doctor you know and trust? They're not the one calling the shots. Instead, there's a new doctor, someone who seems to know every corner of this hospital. Well, let's get into it because this isn't just some random thing. It's actually the result of a quiet revolution that completely redrew the map of Canadian healthcare.
Right. This is the big question. You're in a pretty vulnerable spot, and suddenly the doctor you thought you'd see isn't there. In their place is an expert you've probably never met before. So who is this person? Where did they come from? And more importantly, why are they now such a core part of pretty much every hospital in Canada? Well, the answer to all those questions has a simple one-word name: the hospitalist. It's a role that, believe it or not, didn't really even have a formal title just a few decades ago. So, on paper, the definition is pretty straightforward. A hospitalist is a doctor who specializes in, well, the hospital. They are the in-house experts, the generalists who manage your care from the moment you're admitted to the moment you leave. But the real story here isn't what they are, it's how they came to be. See, this role wasn't created by some government committee or grand top-down plan. It basically grew right out of the hospital floor, born out of a system that was under incredible strain. To really get why the hospitalist exists, we've got to rewind the clock to the 1990s. This was a time when Canadian hospitals were really in a tough spot. A kind of perfect storm was brewing, and it was creating a huge gap in patient care that somebody, somehow, had to fill. Researchers have pointed to three main forces that all collided at the same time to create this crisis. You can think of it as pressure coming from three different directions, all squeezing the healthcare system at once. Pressure from doctors, pressure from the system itself, and pressure from the changing needs of patients. Let's start with the physicians. Family doctors were getting slammed. Their office practices were busier than ever, and trying to juggle a full clinic schedule with the unpredictable 24/7 demands of hospital rounds was becoming almost impossible. Then you add in things like lower pay for hospital work, a growing desire for a healthier work-life balance, and the fact that it's tough to keep your acute care skills sharp when you're not in the hospital full-time. The bottom line? A lot of family doctors started pulling back from hospital duties, not because they didn't care, but because they were stretched to the breaking point. And this shift happened incredibly fast. I mean, just look at these numbers from the National Physician Survey. In just 3 years, between 2007 and 2010, the share of family doctors doing hospital work plummeted from 42% to just over 31%. That's a drop of more than a quarter in the blink of an eye. This rapid exodus left a massive vacuum inside hospital walls. And get this, at the very same time, a huge slice of the population didn't have a family doctor at all. We're talking about 4.6 million Canadians back in 2008. These were the so-called unattached or orphan patients. When they got sick enough to be hospitalized, there was literally no one to oversee their care. This was the crisis that really lit the fire for the hospitalist model. And then, here's the final piece of the puzzle. The patients themselves were changing. Canada's population was getting older, and with age came more complex medical issues. People were coming into the hospital with multiple chronic conditions, needing more intensive, specialized care. So to recap, you've got fewer family doctors in the hospital, millions of patients with no doctor at all, and a sicker, more complex patient population. The system was about to burst. Yeah, something had to give. And what happened next wasn't some new policy handed down from the government. It was a solution that grew from the ground up, innovated from within the very hospitals that were feeling the pressure. It was a true grassroots revolution, and the growth was nothing short of explosive. The very first formal program kicked off in Calgary in 1998 with just a few doctors. A single decade later, there were over 100 of these programs all across the country. In one hospital after another, doctors, often family physicians themselves, stepped up to create these dedicated inpatient teams to care for that flood of unattached patients. Now, this is where the Canadian model really carved out its own unique identity. In the United States, the hospitalist movement was mostly driven by general internists, and the main goal was efficiency and cutting costs. But the Canadian version, totally different origin story. It was born out of a primary care crisis. It was mostly family doctors stepping into the breach, driven by this urgent community-level need to care for those orphan patients.
So the big question is, did this accidental innovation actually work? Well, the data's pretty convincing. Early studies like this one out of Burnaby, BC, showed some jaw-dropping results. Hospital stays were cut by nearly 28%, and readmissions were sliced in half. That's huge. And it wasn't a fluke. Later studies across Ontario and elsewhere kept confirming it. Hospitalist care was just more efficient.
But the story doesn't end with efficiency. The impact went way beyond just getting patients through the hospital faster. Because these doctors were always there, embedded in the system, they started seeing it from the inside out. They became these natural leaders for improving quality and safety, pushing for better patient flow, helping reduce medical errors, and really becoming key partners for anyone trying to make the health system work better.
Of course, anytime you have this kind of rapid, unplanned explosion, it's not going to be perfect. This brand new specialty definitely ran into its fair share of growing pains, and many of those challenges are still around today.
This quote from a national survey back in 2007, man, it just says it all. You have 88% of hospitalists saying demand for what they do is going up, up, up. But at the same time, half of them are saying that their workload is simply not sustainable. They were, in a way, becoming victims of their own success, facing a very real risk of burnout. This kind of pressure really boils down to three big ongoing issues. First, that unmanageable workload we just talked about. Second, the constant struggle to recruit and keep doctors in these really demanding jobs. And third, trying to secure stable, fair funding, because these programs didn't always fit neatly into the old payment models.
But, and this is the key takeaway, despite all of those hurdles, the Hospitalist is absolutely here to stay. They've gone from being these little pilot projects to becoming fully established, essential departments. They are now a non-negotiable piece of the modern Canadian hospital. They were the answer to a crisis, and now they have become the new norm.
And that really brings us to the final thought. The story of the Canadian Hospitalist is more than just a Canadian story. It's this powerful example of adaptation. It shows how a system, when it's put under enough pressure, can actually invent its own solutions, from the bottom up. And as countries all over the world face their own challenges with aging populations and soaring healthcare costs, there might just be a vital lesson in Canada's accidental innovation.